My name is Dipsu Shrestha, and I have based my two infographics on the recommendation report I wrote on uterine fibroids. The intended audiences for the infographic on the left is for patients, specifically women, of reproductive age diagnosed with uterine fibroids. And the infographic on my right is intended for audience members who are healthcare providers such as OBGYNs or clinical decision makers. These audiences are related because they're both involved in the treatment decision-making process of a patient who has been diagnosed with uterine fibroids. Um, where the patients, they are the ones like experiencing these symptoms, they're making their own personal health decisions, whereas providers are responsible for recommending and guiding those treatment choices rather than making the choice by themselves. Um, these audiences also differ significantly, especially in their knowledge level, their goals, and also their responsibilities. Patients often have limited medical knowledge, and they also may feel very overwhelmed by their own diagnosis or the uncertainty of a treatment option or what to do next in their prognosis. So in my patient infographic here on the left, I've decided to use simple language, visual illustrations of the uterus, or even the treatment, and it's very well labeled, I would say as well. That is just assuming that many patients are not knowledgeable on the parts of their reproductive systems. So each of the images right here, as you can see, they have labels of parts of either the treatment tools, or just the reproductive system, or what is in that image there. One of the key features I've included is this section right here. In the What Matters Most to You section, it helps patients make decisions based on priorities like fertility, recovery time, and also avoiding surgery. Those are some of the values that most patients do have. And I feel like it's really easy to read here because if you're skimming through your infographic and at the end, just really quick, let's say, for example, I'm a patient looking at this, and one of my key priorities of a treatment option is definitely to preserve my fertility because I want to have children in the future. So as you can see here, all I would have to do is, okay, so yeah, I do want to have children in the future, and out of these three treatments, it tells me that a laparoscopic myomectomy would be my best choice. So I feel like that feature really reflects their need for guidance and also kind of reassures the patients that after you reading all this information, at the end you have something to just go straight off of there. In contrast, the healthcare providers require more analytic and data-focused information. So in my provider infographic, I included specifics, statistics such as percentages, and the main key feature I would say is definitely this bar graph right here. Excuse me. I have included a bar graph comparing the three treatment options. So a myomectomy, the ultrasound, as well as a UAE. And this, I have made the bars so that we can easily compare the three um, values right here, which is invasiveness, recovery time, and fertility preservation. It just allows providers to quickly evaluate like trade-offs between options. Additionally, I also included clinical, takeaways for providers. I feel like this really helps. Um, like providers give direct, actionable steps such as assessing patient priorities and avoiding defaulting to a hysterectomy. I've also wrote here that is very important. to stay informed, assess their priorities, like I mentioned, discuss all the treatment options, and then supporting them, and then highlighting each of the main words here really help bold out what the message is trying to bring forward. The decision feed the design features of these infographics also differ significantly based on the audience's needs. The patient infographic uses bright pink tones. They have curved shapes and visual that are really large, making it more approachable and less intimidating. It looks pretty and pink, and it doesn't look so structured, so it's not something like, oh, okay, this is very information heavy. It's just very simple and just less intimidating. The layout is less structured, like I said, with each treatment explained in a simple, small block of text. Whereas the provider infographic, it uses more neutral colors. It has structured settings and it also has clearly labeled headings, which creates a more professional and organized appearance. So the inclusion of the bar graph and bullet point recommendation makes it more, I feel, analytic and aligns with how providers actually have been taught to process information. I feel like they're used to reading a bunch of research papers and textbooks that are similar to um, this writing, which is more word heavy and also is more data heavy. Um, the information included and omitted in each infographic was also intentionally different. So in the patient infographic, I included basic explanations of each of the treatments, like I mentioned, and I did highlight key considerations at the bottom here. I made sure to add that it obviously all the treatments, it's not made for everyone, and it's right for you to talk to your doctor. And then I also made sure to add information about hysterectomy here because a lot of doctors do just straightforwardly recommend hysterectomies, which is not very wanted for most patients. And then for the infographic to the right, it does include datas, comparisons, and more clinical language. I omitted using a bunch of label diagrams because you would assume that the healthcare providers already know um, what each part of the body part is, and they're very knowledgeable on the anatomy and physiology of the human body. Yeah. So I also omitted basic explanations of what uterine fibroids are on both of these because I would assume the patient and the clinical provider are both in a stage where they already are understanding what there are the uterine fibroids are and what the patient has. So the next step would be the treatment options. So that's why I did not include what a uterine fibroid even is. Um, I did focus more on summarizing key insights and also supporting like clinical decision making for each the patient and the clinician. Overall, these infographics just demonstrate how the same topic can be communicated differently depending on the audience by directly adjusting both the design elements, like how I have done the color, the layout, the visuals, and also the content put into the infographic, such as like the type of information, the tone, or the level of detail, and just the message you want to put forward. And yeah, so I created one infographic that supports like patient understanding and another that supports provider decision making. So this just highlights the importance of really tailoring communication to meet the specific needs and roles of different audiences here. Thank you.